Yeah, so I wanted to pick up where we left off on that healthcare discussion. We've been using the word Orwellian nightmare to describe the lowlights of this system, and we can just see what they're planning on doing. And I find it very disturbing that they know that there's going to be rationing, and yet they are hiding that. I mean, they know that they're putting us that on us, and that can't be good for anybody, and yet they're still pushing this. And another thing that they know too is that this is not about having just a public option insurance plan. That's the gist of HR 3200. If there's a video circulating around the net where they talked about, okay, by the way, by they I mean the supporters of this, primarily Democrats, including Nancy Pelosi, and of course Barack Obama, talking about how this is actually going to be the transition from a single, a market, what's left of the market healthcare system, to a single payer healthcare system, meaning that the government, single payer being a euphemism in and of itself for the government controlling national healthcare. This is it's a horror show, and they know it. They know that this is going to lead towards the government dominating the market. And, we have enough history now. We see how well centralized planning works out, and yet they're still trying to push it. And, we have enough history. We certainly have the theory as to why socialism doesn't work. Mises wrote that book back in the 20s, predicting the end of the Soviet Union. And the gist of the book is that you cannot have central planning can't work because pricing is a function of voluntary choices. If you don't have voluntary choices, you can't have pricing. And if you don't have pricing, the market doesn't know how to allocate resources. That's what they don't tell you about this. So why is it that there is support at all on any level? Because we know that theoretically it doesn't work. The theory has been proven, based on a century now of socialism, and yet there are people who still are deluding themselves into wanting this, that this is somehow going to work out, that the government's catch-all promise of something for nothing is finally going to pay off. And I had a conversation last week with a couple of friends, dear friends who are on the left, and their concerns are genuine. They're based on their own needs to some degree. They're certainly based on compassion, and I understand where they're coming from. And they are in such a panic about this. The government has put us into a panic. We are in this fight or flight mode, a fear that something's going to happen and we won't have insurance and we won't be able to take care of ourselves. And they just want it to go away. They want the government to just make it so that they don't have to worry about that. And I think that's really the reason why we're doing this. But you notice how the government never comes back to you and says, oh, by the way, we understand what the issues are, and it's because we're involved too much, and what we really need to go towards is the free market. They never tell you that option. They always blame it on the free market. If it isn't clear to you at this point, it's the government versus the free market. That's what we're up against here. So we never get that solution, when in reality, that's really what we ought to be doing. There's no reason why healthcare can't offer a wide array of choices and services, just like everything else that the free market does, except for the fact that it can happen now because the government is involved in everything from regulating, licensing. Only certain people can provide certain services, irrespective of what two consenting adults want, whatever kind of contractual relationship that they want to have. You have unbelievable regulation just to build health facilities. You cannot imagine the cost per foot that goes into a health facility because it's so regulated. There is the HMO, the Health Maintenance Act of 1973 itself makes it so much money goes into the system, whereas you used to have a system that allowed the doctor to come up with the best value choice along with his patient. Now he just charges the most that he or she can because insurance will pay for it. So I'm going to stop it here now and go on to part 3.